You've probably heard the word eczema, right? But what does it actually mean? Well, today we're going to unpack this really common and, let's be honest, often frustrating skin condition, which is also known as dermatitis, to get a clear picture of what's really going on.
Right, so at its very heart, eczema is just an inflammatory response from the skin. Your skin is basically overreacting, and that's what leads to all those classic symptoms. The redness, the incredible itchiness, and sometimes those tiny little blisters. Fun fact, the name actually comes from a Greek word that means to boil over, which, if you've ever had a flare-up, is a pretty spot-on description of how it can feel.
So, to really get to grips with it all, here's what we've got on the cards. We'll kick off with the basics of what eczema is. Then we'll dive into the different types and what causes them. After that, we'll look at how it's diagnosed, how we can treat it, and finally, what it's actually like to live with it day to day. It's the whole journey, really, from the problem right through to management.
Okay, let's jump straight in with the fundamentals. What exactly is eczema? We'll start by looking at how it actually shows up on the skin, because believe me, it doesn't always look the same. You see, eczema really has two main phases. First, you've got the acute phase. That's the angry, red, swollen rash that can sometimes look a bit weepy or crusty. But if that carries on, it can turn into chronic eczema. And this is where you see something called lichenification. It's a real telltale sign of long-term eczema, where all that repeated scratching makes the skin become thick, leathery, and almost like tree bark. So the big question is, what kicks off this inflammation in the first place? Well, the triggers can be sorted into two main camps. You've got the external factors that happen to your skin, and then you've got the internal factors that come from inside your body.
Now, the official terms are exogenous and endogenous. Exogenous sounds a bit technical, but it just means external. So something in your environment, like a harsh soap or a particular allergen. Endogenous means internal. This is more about your body's own wiring, often down to your genetics. So if we look at those external triggers, there are some very common culprits. Irritant and allergic contact dermatitis are two of the biggest ones, and we'll look closer at those in just a moment. But triggers can also be things like photodermatitis, which is a reaction to sunlight, or even napkin or nappy dermatitis in little ones. And on the flip side, for the internal triggers, the problem is coming from within. Atopic dermatitis is the classic one. It's the genetic type that often goes hand in hand with things like asthma or hay fever. Then you've got other forms like seborrheic dermatitis, which pops up in oily areas, and pomphilex, which causes these really deep, intensely itchy blisters on your hands and feet. This table does a fantastic job of showing the difference between those two really common external types. And here's the crucial thing to get. Irritant dermatitis is just direct skin damage. Literally anyone can get it if they're exposed to something strong enough, like a harsh chemical. Allergic dermatitis, though, that's an immune reaction. You have to be genetically wired for it and already sensitized. And look at the distribution. An allergic reaction will often perfectly match the shape of the thing you're allergic to, like a watch strap or the metal stud on your jeans. Now, for so many people with eczema, especially the atopic kind, this right here is the real enemy, the itch-scratch cycle. It's so simple and so infuriating. It starts with an itch. So what do? Yes, scratch it. But the scratching causes a rash and makes the skin even more inflamed, which then, you guessed it, makes it even itchier. It's this horrible, vicious loop that is just incredibly difficult to break. Okay, so bearing in mind all these different types and things that can look like eczema, how on earth can a doctor be sure what they're actually looking at? Let's take a look at the diagnostic process. Whoa, okay, this might look a bit intimidating, but don't worry, you don't need to memorize it. It just shows the brilliant detective work that's involved. A doctor will ask a whole series of questions based on what they can see. Is the rash clearly defined? Is it scaly? Where is it on the body? Every answer leads them down a different path and helps them rule other things out. And this is exactly why that detective work is so important. A rash isn't just a rash. Eczema can easily be mistaken for a fungal infection like tinea, or an autoimmune condition like psoriasis, or even something like scabies. So getting that diagnosis right is the absolute first step to getting the right help. Which brings us neatly on to our next section, treatment and management. So once the diagnosis is confirmed, what's the plan of action?
Well, the approach you take really depends on the state of the eczema. For that acute, weepy stage, the main goal is to dry the area out, often using things like wet compresses and lighter creams. But for chronic, thickened eczema, the focus completely shifts. Now, it's all about softening that skin with thicker ointments and special ingredients called keratolytics, which help break down that tough, scaly surface.
But, and this is so important, before you even reach for any creams or medications, this is the single most important step: education. Understanding that vicious itch-scratch cycle we just talked about is absolutely key. All the treatments in the world won't be as effective if the person just keeps on scratching and rubbing the area. Breaking that cycle is everything.
Right. Finally, let's talk about the long-term reality of living with eczema, because for a lot of people, this is a chronic condition that they manage for years. And it is not just a bit of dry skin. The complications can be quite serious. When the skin is broken, it's vulnerable to nasty secondary bacterial infections like Staph aureus and even some really dangerous viral infections. And beyond the physical side, the constant itch and the visible nature of it all can lead to depression and anxiety. For kids, disturbed sleep can even affect their growth.
So what's the long-term forecast? This quote gives us a pretty realistic picture. For many who get it as children, the good news is it will often clear up on its own. For others, though, it can be a persistent condition that lasts for many, many years, with periods where it flares up and then settles back down again.
So, there we have it. We've seen just how complex the causes are, the real detective work involved in diagnosis, and how crucial the right management is. It really all leads to one final thought, doesn't it? For a condition that's so tangled up with our habits, our environment, and even our genes, is simply understanding it better the most powerful first step towards finding relief. Thanks for joining me.